The triple-demic is now in full effect. Hospitals now seeing a mix of COVID and RSV combined with the worst flu outbreak since 2010. Flu cases rapidly increasing since early October. Flu season typically peaks between December and February, but some doctors are saying this one could last even longer. So to give us some better perspective, let's bring in Dr. Gandhi, professor of medicine and associate division chief at the University of California, San Francisco. Dr. Gandhi, thank you for being with us. Why are we seeing this surge in flu and these other respiratory viruses now?
You know, we're seeing them because we kept away from each other for the last 2.5 years because of COVID. And I think that that's really what's going on. If you look at a paper that was published in PNAS, which is one of our highest levels papers preceding National Academy of Sciences, in June of 2020, they said, once we get enough population immunity to COVID, we're going to have a really bad flu season and a really bad RSV season. They actually predicted this 2.5 years ago because all of our immunity is going to be down to those two viruses. And I think the other reason is as our population immunity rises to COVID, COVID can't interfere with these other viruses as much. They do interfere with each other. It's why it's not impossible, but you don't usually have flu and COVID at the same time. If you test positive, one is really causing the illness. And it's called viral interference. So I think we have less viral interference from COVID. We have what's called immunity debt, and we're seeing this terrible season, and it's hard to go through.
Yeah, it really is terrible. I don't know if we can bring back that map that we just showed there. We're seeing a lot of reds, a lot of purples, and that shows the very high, the highs. Flu hospitalizations, as you know, doctor, are at the highest in over a decade. Is this year an outlier, or is this really kind of a new normal that we're just going to have to deal with?
Well, usually we have, prior to 2019, we unfortunately do have 40 to 50,000 deaths from influenza every year. And right now we're seeing a very high increase in hospitalizations in influenza. Hopefully we can avert too many deaths. But the reasons are because essentially we have H3N2 as our dominant strain. This is a strain that is not very benign. In fact, in 1968, it caused quite a pandemic, and it looks like this particular strain is pretty, it has a high rate of hospitalization. Seeing that in the UK as well. That's what happened in the UK. Actually, more people in the ICU for influenza than COVID, for sure, in the UK. So it is a bad strain. And then we have a 40% vaccination rate right now in the United States. We've had lower rates of vaccination than we did in 2019. Of all the years, this is the year to get influenza vaccinated. We didn't have much flu last year, and we had higher rates around this time of year of influenza vaccine. So please do get it. It's from 6 months to as old as you can be. Right. But over 65, it's a higher dose of the influenza vaccine. Please remember to ask for that.
And just really quickly, doctor, seeing so many cases, seeing them, predicted to last for a little bit longer, how concerned are you as a physician this year?
I'm an infectious disease physician, so I am concerned. I am seeing a lot. We are seeing a lot of RSV and influenza. I saw it last week when I was in service. I am concerned. I also think that it's partially because we used all these ways of keeping away from each other. And I kind of predicted, and so did many others, that we were going to have to go through one bad season. And I think this is that season. And we just have to buckle down and work hard, get influenza vaccine, get antivirals we have an antiviral for influenza, and get antivirals for people with COVID.
Yeah, we all want to stay safe. All right, Dr. Gandhi, thank you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.